Okay, so this is also something that's very difficult to do just in isolation, just looking at a number. If we were seeing somebody in our clinic, we would be looking at the patient as a whole, finding out about their medical history. So there are some important things to know. First is, have you had previous PSAs, and what is the trend? We'd like to look at that. So a rapidly rising trend is more concerning. Let's assume for the rest of the discussion that this is your first time PSA and it's a single reading. So the next thing we need to know is, are you in what we call a high-risk group? So do you have a family history of prostate cancer? For example, primary relative, father, brother with prostate cancer. That raises your risk significantly, and we might look at the same number in that man differently than we would in another man. We need to know your age, and I'll come back to that. Race, so if you're of African Canadian origin, ancestry, then you're going to be, again, there may be some other risks that we have to factor in. The other thing is whether your rectal examination has been done and if it's abnormal. So clearly an abnormal rectal exam at any level of PSA is something that needs to be investigated, and we should see you, or a urologist should see you, to work that up. So looking at the various numbers, men that come to our screening program or get screened in their family doctor's office usually are over 40. So if you're over 40 but under 50, there are a couple of benchmark numbers. So if your PSA is under 1.0, you're probably safe. And we just recommend you probably can go 5 years before you get another PSA done, maybe every 4 or 5 years thereafter if it stays very, very low. If your PSA in your 40s is higher than 1.6, so there's a bit of a gray zone, 1 to 1.6, we would suggest that gets repeated. If your PSA is over 1.6, even though that seems very low, we think you should get it repeated more often. So every 2 to 4 years. If it's over 2.5 to 3 and you're in your 40s, really you should be seen by a specialist and be assessed. So moving to men in their 50s, generally 2.4 and less would be considered a so-called normal number. I'll talk about that again in a second. But really our safe number is once again sort of 1 to 1.6. If it's less than that, just like the guy in his 40s, you can probably go to every 5 years. If your PSA is between 1.6 and 2.4, then I think you need to have it repeated more often. And if it's over 2.4, then you should be seen and assessed. In your 60s is another critical benchmark. If your PSA is 1 or less, then you probably don't need any more PSAs done, because data shows that you're highly unlikely to ever have advanced prostate cancer or die from prostate cancer. If your PSA is under 2, so over 1 but under 2, then we think you're probably still safe. You might consider, if you're really interested, have another one done in a few to 3 to 5 years. In your 70s, it's a tougher call. We're not really recommending men in their 70s get screened. If you are in your 70s and you wanted to be tested and you have your result, generally I would say if you're free from any other risk factors we've discussed, if your PSA is 4.5 and above, you're probably okay. So coming back to what I was saying before about the normal value and why this is complicated, is that what we've learned is that there's no such thing as a normal PSA. So even though on our on our result forms it says 3.1, some labs say 4.0, the reality is PSA is a spectrum of risk. There are men who have a PSA of 0.5 and actually have prostate cancer. There are men with a PSA of 20 who do not have prostate cancer. So it's very tough to say that there's a level at which you're safe and you don't have cancer. The better way to look at PSA is, beyond the levels I've discussed already, it just means you're at a higher risk and should be considering being assessed. If you're below those levels of risk, for example, the 50-year-old guy with a PSA of 0.8, I don't think you really have to worry about it. Maybe get rechecked in 5 years. So clearly, if your PSA is over 10, no matter what age you are, that is something that we have to assess. And one of the first things we do if somebody's referred for assessment is we repeat the PSA. One of the other problems with PSA testing is that sometimes there's some variability in the results. So really, before anybody goes on to have a biopsy or really any further serious investigation of their PSA, they should have a repeat. So One of the problems, I guess, that comes up is that some men that get this PSA done at our clinics, their family doctors are not interested in necessarily seeing the results, which I think is a shame because actually that doctor should be probably educated by the patient about the U.S. Task Force latest change in recommendation, which has just come out this year, moving it from a D to a C recommendation, which is discuss this with your physician, discuss the pros and cons. So with that recommendation, I would have a problem with somebody going to their GP with a PSA and the GP not wanting to discuss it. I think at the very least, even by guideline recommendations, the GP should discuss it, even if they're somewhat negative. And I would say that the best next step for anybody with a PSA that's of any concern is a repeat. And if it's still in the concerning range, then ask your family doctor for a referral to see a specialist.